Hello, I'm Dr. Zale Kalsa of Inner Health Chiropractic in Beverly Hills, California. Today we're demonstrating how we examine and give an adjustment to a newborn infant. When a child is born, they come through the vaginal canal upside down. The typical presentation is left occiput anterior, which as they go through the canal, there tends to be a torquing, twisting injury that can happen to the upper cervical spine. And this can affect the nerves. Common consequences that we would see later on would be chronic ear infections, colicky babies. I'm going to demonstrate today how we would examine and correct those problems.
You're a good, strong, healthy boy. Yes, you are. Yeah. Healthy boy. Yes, yes.
This is Bowie, and we're going to demonstrate today how we evaluate and adjust a newborn infant. So we're going to check tone, which is how tight or how loose the musculature is, which is a reflection of the tone of the nerve system, through a simple procedure. It's an infant, so we can't check posture by having the baby stand up. So what I'm going to do is hold Bowie by his ankles. I'm going to grab him symmetrically and carefully, and then what I'm going to do is lift him up. And I want to see, does he hang straight? So I'm going to look for, is his spine straight? Is the head tilted left or right? Is there rotation of the head? And what we've tended to observe with Bowie is that there's a rotation and a twist, which is common with an infant, as we talked about. So I'm going to have Bowie's mom help me set Bowie down here. Okay. And I'm just going to spin him around on the table so that I can demonstrate how I'm going to do a further examination. So I'm going to use my fingertips to palpate his upper cervical spine and occiput. And so we've worked with Bowie before, and there's been tending to be some constriction in the right upper cervical area. This is very common even after a natural birth. Bowie's mom had a completely natural birth, but even so, birth is a traumatic experience, as most new moms will tell you, and it's trauma to both the mom and the baby, and even more so when it's a cesarean section or a forceps delivery or a breech presentation. So there's a little bit of irritation on the right upper cervical spine, and as I hold some pressure there, the child obviously can feel it. And so I'm just holding a very, very gentle contact, about the weight of a quarter on your fingertip. And it's a very delicate fingertip pressure. And that's all, just a little pressure, and I release, and that's all it takes. We would recheck the child's posture again if there had been a distortion and look for an improvement. And that's basically how we do an evaluation of a newborn infant. Thank you.